Therapy allows blood pressure monitoring or strong for illness wellness and family.
I study Catholic University Nursing School. My name is Cinthya Cando.
Our definition. They include assignments that are the result of individual solution on problems, depending on commonly which involves learning to manage the of unknown each one God of who aspects of us in the sense.
The testicles of adult men produce about 500 million sperm each day. By contrast, women generally release only one egg per month. In order for fertilization and conception to occur, one of a man's many sperm must join the single egg released in a woman's oviduct or fallopian tube. There are many causes of infertility, and oftentimes the reason for a couple's inability to conceive is never determined. Some known causes of infertility in men include low sperm count or non-functioning sperm. Infertility in women can be caused by many factors. Some known causes can include failure to ovulate or blocked fallopian tubes. Severe endometriosis, a disorder where pieces of the uterine lining stray and adhere to reproductive organs, is also a common cause of infertility in women. Diagnosis and management by a physician may be successful in treating some couples with infertility. Some cases of infertility can be treated with medications or surgery. A physician can also discuss alternatives to natural conception, such as donor sperm, donor egg, and adoption.
Application intelligence and the government radiomeography can identify responsibility for finding psychosocial work, second law, that derive with standard therapy.
Hi, my name is Neil. This is my wife Neela, my 4-month-old Sandeep, and my almost 3-year-old Sapna. We went from the two of us, dual income, no kids, both of us working, to 2 kids, 2 businesses, and complete chaos.
We decided to have kids a few years after we got married, and we just kind of thought, okay, well, we'll just, go off birth control and we'll get pregnant. And probably after about maybe a year of just sort of trying, we were like, this is a little weird, we weren't getting pregnant. Then we went to see the OBGYN, and they ran some initial tests and everything, and they told us that, there may be a problem with fertility, and they recommended that we see a specialist. As a physician, it was a little frustrating for me, because I thought, well, we're doing things right, why isn't it happening? But, as we went through the workup too, initially we couldn't find any, pinpoint any specific problem. Oh, well, just fix this one thing and then, there you go and it'll happen. And so it was just, all our testing came back normal. It just really wasn't an explanation for why we couldn't have a baby.
While we were fortunate with Suppi, we had her on our second IUI cycle. Sandeep was certainly a little bit more difficult. We probably went through a number of cycles and had to come back and talk about other alternatives, and the clinic was really good about explaining kind of all of the opportunities and all of the things that we could do. And
really just hang in there, because it really is hard every month that you don't get pregnant. It's I don't know, it makes you kind of question, is it really worth it? But, ultimately when it happens, it's such an awesome experience that it really is totally worth that struggle to get there.
Long time, long years. Then, even long also on my phone, and now on my phone, I have arranged I follow the channel that Grandma has the watch variety to eat until I saw perform at the level of the hypothalamus and pituitary.
Thousands of couples struggle with unexplained infertility. But if a woman has at least one patent fallopian tube, the typical approach to treatment is ovarian stimulation, followed by intrauterine insemination. A common clinical question is which agent to use for the ovarian stimulation. The goal is to achieve a viable singleton pregnancy. In this prospective trial, 1,200 couples with unexplained infertility were randomly assigned to receive ovarian stimulation with gonadotropins, with clomiphene citrate, or with letrozole. With letrozole, conception rates and live birth rates were significantly lower than with gonadotropins or clomiphene citrate. The multiple pregnancy rate with letrozole did not differ from that with clomiphene, but both were significantly lower than the multiple pregnancy rate of just over 30% with gonadotropins. In summary, the rates of pregnancy were higher with gonadotropins and clomiphene citrate, but stimulation with gonadotropins led to a higher rate of twins or triplets. The authors conclude that for couples with unexplained infertility and imaging showing at least one patent fallopian tube, ovarian stimulation with clomiphene citrate, followed by intrauterine insemination, remains a first-line therapy. Full trial results are available at nejm.org.
Go to infertilitycure.tk for a natural infertility cure. Holistic infertility cure for couples who struggle with infertility. Infertility affects approximately 10 to 15% of couples in the world. This problem can come from different conditions in your body, including infections and cysts inside the ovaries and reproductive tract, to excessive secretion of glandular hormones. There are many infertility treatments available. The best thing to do is to identify the actual reasons for this problem and then cure them. So stop searching for how does getting pregnant work, fertility methods for getting pregnant, infertility treatments, female infertility treatments, will I get pregnant, infertility women, reverse infertility, natural fertility help, fertility issues when trying to get pregnant, help to conceive, help conceiving, ways to help me get pregnant. Just go to infertilitycure.tk for a natural infertility cure.
My name is Lisa Olson, and I'm a certified nutrition specialist, health consultant, medical researcher, speaker, and author. I'm also a former infertility sufferer. Over the past 14 years, I've helped thousands of women in 130 countries get pregnant naturally and give birth to healthy children. And today, I would like to help you. That's right. In just 4 to 8 short weeks from now, you could be sending baby shower invitations to your friends and family.
Thank you.